Have you ever wondered why you're experiencing more gout flares after starting medications to treat gout flares in the first place? This is a very, very common question I get in clinic, and more so these days with the holidays coming in, that good fall food. So, in today's video, I'm going to delve down into gout and see how you can reduce the risk of flare, particularly when you're starting medications. So, how can gout manifest? So, gout can manifest as a painful, red, hot, swollen joint. I mean, a very painful joint. Probably one of the most painful things a human being can experience. Um, but it also can affect the skin. So, you can have something called tophaceous gout. This happens when there's an overaccumulation and you get this deposit, like this really hard deposit that sticks to a joint. It can cause an erosive disease, so it can actually cause damage to the actual joint. But sometimes you can also find it in weird places like behind the ear or just kind of like randomly on the skin. Um, Another manifestation of gout, it can affect the kidney, so you can get a kidney stone from gout. In that case, you really want to make sure that you start treatment really quickly. So there's several medications that we can use to treat gout. So there's prophylactic medications. So these are medications that are used to abort a flare. So those include things like colchicine. You can have NSAIDs like ibuprofen, naproxen, as well as prednisone. You can also use these very fancy medications called interleukin-1 inhibitors like anakinra, but these are specialty medications and typically are used in the hospital, uh, but they can be used to abort flares. Now, the second category is medications that help reduce the uric acid in the body. So these are prophylactic medications. So they're meant to reduce the number of flares. So those include allopurinol, something called Uloric, and probenecid. You also have these specialty medications called Krystexxa, but that's an IV treatment that's provided in an infusion center and generally not commonly utilized. So when is the best time to start medications to reduce the amount of flares? So there's a few scenarios. So generally speaking, if you've had one flare or you're having one flare per year, um, you don't start. You just kind of treat the flares as they come. But if you're having more than one flare a year, then we'll usually start treatment with allopurinol. But to be honest, the choice of medication really will depend on a person's situations, and that I would recommend that you discuss with your physician. Another reason why you would start uric acid lowering medications right away is if you have a history of tophi, so if you have that accumulation of uric acid, or if you've had a kidney stone. Another reason will be if you have underlying kidney disease, usually chronic kidney disease stage 3, and your uric acid level is greater than 9. So in that case, even with one flare, generally speaking, we will start treatment. So you've started treatment with allopurinol to reduce the risk of flare, but now you're having more flares. So obviously that's really bad and very painful. The most common reason I see in clinic why that may be happening is that the dose of the uric acid lowering medication is too high. The trick is to go low and then you slowly titrate until you reach your blood level that you're targeting. So in my clinic, I typically use allopurinol, and I usually start with 100 milligrams a day, and then every month I'll repeat the blood work for uric acid, and then slowly titrate the medication slowly but surely until I reach a serum uric acid level of less than 6. So that may be one of the reasons you're just going too fast. And then the second reason I see is that you're not using a prophylactic medication like colchicine, NSAIDs, or prednisone, depending on your risk factors. And usually you want to continue these medications for the first 3 to 6 months of starting a uric acid lowering medication. And after that, you can take them off and just continue with allopurinol or Uloric. That's probably that's the second reason, the most common reason. The third reason is that you really haven't changed your lifestyle. By lifestyle, I mean your food. So there are certain foods that you want to avoid, and there are certain foods that you want to incorporate into your diet. So the things you want to avoid are things like sugary drinks and sweets, high fructose corn syrup, alcohol. Now, certain alcohol is high in purine, so anything brown, so beer, scotch, whiskey, bourbon, but even not like things like wine, they do reduce your body's ability to expel uric acid, so you want to avoid that as well, or take in moderation. Other things are organ meat, so anyone who loves their liver, game meat like venison, just plain old red meat like from beef. You can also get more uric, more flare-ups from certain seafoods like scallops, mussels, but also fish like trout and tuna. Another meat would be turkey. So even though it's lean, it's actually full of purines, as well as gravy and meat sauces. In terms of foods that help with gout, so milk, cherries, coffee, and the most important is drinking a lot of water. So I hope this was helpful. And if you have any general questions about gout, just leave it down in the comment section below. And if you have any ideas about future videos, again, just leave it in the comments below.